Hi, I'm Macie Robinson. I'm in Foundations and I'm going to be performing my NG feeding today. I'm going to go through my supplies really quick. I have some non-sterile gloves, just clean gloves, hand sanitizer, lubricant. I have some sterile saline or sterile water, measuring tape, blue waterproof pad, a syringe, and my stomach tube, 12 French, 11 tube. So I also have pH paper and a kit to measure pH. So I'm going to begin my procedure now. I would enter and provide privacy, introduce myself. I am Macie and I'm going to be your nurse today. We're going to be inserting your NG11 type tube to administer your feeding. It's not going to be particularly comfortable, but it shouldn't be painful, and it'll help get you some nourishment for your body. So at this point, I would raise the patient up. I'm going to raise them up to a comfortable working height so that I'm not bending over the patient. And I'm going to hand sanitize and identify the patient. Could you verify your name and date of birth for me? I'm going to check that on the patient's wrist. I'm also going to verify the work orders with the medical record to make sure that this is the right patient and that this is the right procedure to be done. At this point, I'm going to perform a small assessment on the abdomen, and the vital signs were within a normal range. I would auscultate all 4 quadrants before I palpate, and I have provided privacy. And then I could palpate the stomach, looking for any tenderness or firmness. Okay. And now I can elevate the patient to a high Fowler's position. Okay. And now I'm going to put this blue pad over the patient's chest in case there's any contents that are aspirated. I'm going to give them a cup of water, a missus basin, and a paper towel. Okay, and so this procedure is going to be uncomfortable, but as I'm inserting the tube, you're going to lean your head back, and then whenever you feel yourself start to gag, tuck your chin and start swallowing the water, and it'll help the tube advance into the stomach. So once I've explained the procedure to the patient, I'm going to put on my gloves. I'm going to get my tube and I'm going to measure from the near raise to the earlobe, and from the earlobe to the xiphoid process. I'm going to mark this point with a piece of tape. Okay. And now I'm going to lubricate the tip of the tube. Okay, and I'm going to begin inserting the tube. So swallow the water whenever you feel your gag reflex and tuck your chin. I'm going to go against the back of the throat so that I don't enter the lungs, and advance the tube slowly. Once I've reached the tape, I'm going to secure the tube to the nose. And now I'm going to flush the tube with 30 milliliters of sterile water. I'm going to place my syringe, sterile water, and drop 30 milliliters. I'm going to attach that to the end of the tube and flush the tube. Before I do this, I want to verify the placement of the tube by bringing up stomach contents and looking at the color and the consistency, and I could check the pH by using my pH paper. I could also order an x-ray to make sure that the tube is placed, so I'd want to do that before I insert the 30 milliliters of water. Okay, and if that goes down slowly, then I'm going to start administering my feeding. So then I could fill up my syringe for my feeding. And I could administer that feeding very slowly. I could also flush the tube again to clean out the tube from that feeding. And now I'm going to remove the tube. Remove the tape that's holding it. Okay, now just take some slow, deep breaths and tuck your chin. Move it out very slowly, pausing so that they can breathe. And wad the tube up in my glove and throw that away. Okay. And then I could reassess the abdomen and check for any hyper or hypo stomach sounds. Okay, and if we had a type of feeding that was hanging up on our IV pole, we would want to check the feeding and the tube placement every 2 to 4 hours. And we're going to offer oral hygiene every 2 to 4 hours. Also, before I administer the formula, I would check the expiration date and label the formula with the time and date. I'm going to have the patient remain in the upright position for at least 1 hour after the feeding to make sure that that digests and doesn't come back up. And I could also measure the tube while I was in and make note of that so the nurses know how far the tube should be in if the feeding was hanging on the IV pole. Okay. And then I'm going to lower the patient while keeping them in the high Fowler position. Remove my gloves, make sure their call light is nearby, as well as their bedside table and their phone, and I provide privacy and sanitize on my way out.